Good evening, everyone. Welcome to the Renaissance Center chat. We are glad that you are here with us this evening, and we have a great program for you. Remember that you can always put your questions or comments in the chat, and that will, help us to be able to answer some of your questions on the spot. So keep that in mind. Again, welcome to the Renaissance Center chat. I'm Dr. Carla Debnam, and I am your host, and we will get started. We have a very special guest, Dr. Carmen Ferrier, who's a OBGYN and just an area of women's issues. So we're going to talk about the changes and different things that women go through. We also know it's Domestic Violence Awareness Month, as well as Breast Cancer Awareness Month, among other things. And we wanted to address a multitude of concerns that we as women have. And of course, this is not for women only, this is for everyone who wants to support a mother, a friend, a spouse. Any of us can be impacted, a friend, with these different issues, and we need to know how to support one another. So, welcome. Okay. All right. So we're ready to get started. Dr. Carmen, if you could just introduce yourself and give the audience a little bit of your background.
Hello, my name is Dr. Carmen Ferrier. I've been practicing in Baltimore, Maryland for over 23 years now. I have a great passion for educating women about their health. It's very difficult in the office to do so because we're under such time constraints. So I'm always excited when I'm invited to talk a little bit about women's issues. It's very important that we know our bodies so that we can be our own advocates when we go out to see our physicians.
That's great. And we're going to get right in, and remember everyone, you could put your questions or comments in the chat because we want to make this as personalized as possible. But as you know, we have our questions, and we want to start off with a question that some of us, or maybe many of us, are impacted by, which is menopause and how it can impact women, especially Black women, differently. And sometimes these changes can be physically and emotional. One thing I saw that you might know more about is that Black women start menopause earlier uh, on average, or perimenopause earlier on average than other women. So we can start with that, and then we'll go into the emotional and mental piece.
Okay, I want to just back up just a little bit and do some definitions because
Okay, great.
I get confused with the semantics of menopause. So we have premenopausal, those are the women who get their periods every month for the most part. Those are the fertile women who are still in their active fertility phase of life. Perimenopause is where a lot of women live, where their hormones are flushing all over the place and going back and forth. They may experience hot flashes, night sweats, mood swings, but yet they still get their periods. So that means you're about to transition. You just don't know how long it lasts. For some women, that can last for like 5 years before they actually start to go through menopause.
Mm.
Menopause means you haven't had your period for an entire year, and then that is official menopause. And then
Mhm.
you become postmenopausal. So we spend about a third of our lives postmenopausal. And
Mhm.
Black women, some of us do tend to go earlier into menopause, which
Mm.
means we could be spending even more of our lives as a menopausal person. So it's important that we understand what happens to our bodies and what we can do to maximize our health in the future.
Yeah, and I know we talk a lot about the physical aspects of menopause, which is definitely important to know. So if you could talk a little bit about that, and then we'll get into some of the mental and emotional parts as well.
Most people just attribute menopause to the flashes because that's the thing
Mhm.
that bothers us the most. We're hot, we're sweating, it's embarrassing. You're just breaking out in a sweat in the middle of a meeting, Everybody knows what's happening to you. Your glasses are steamed up, underarms are getting moist, and it can be quite disconcerting for a lot of women. Not to mention if you're having them at night. A lot of women can't sleep, so now you're irritable, you haven't gotten the proper rest. And we all know that not getting proper rest can also affect other parts of our health. So that's one of the main things that people notice. But
Mhm.
also, as we go through menopause and we spend more time there, we may start to notice genital and urinary changes. Women may have more urinary tract infections because our estrogen levels affect our vaginal tissues and our urethral tissues. And then we end up getting more urinary tract infections because the space has decreased. Vaginal dryness is a problem. So some women have painful intercourse, which of course is going to affect the libido because if it's hurting you, then you're not going to be interested in having any intercourse. And one of the silent things that people don't always realize
Mhm.
that estrogen helps our bones. So when we go through menopause, we really, really have to make sure we're taking our calcium, our vitamin D, to do weight bearing exercises to be
Mhm.
sure that we're going to keep our bones strong, particularly Black women who may go through menopause early and already don't have great ability to absorb vitamin D from the sun like some of our
Yeah.
other parts.
Yeah, that's great. That's a great information because a lot of times we go to the doctor and they say, "Oh, you need to start taking calcium. You need to start taking vitamin D," without an explanation. And some of us kind of get it, but some people don't. So that's a great way for us to be more informed, or at least to ask those kinds of questions when we're in the office and they say, "Do you have any questions?" And it's okay to go with your list of questions because that helps the doctors be able to help you, with your concerns. So keep that in mind. We know some of these things we were all taught not to talk about, even natural progressions in life, because everything seemed to be a secret. That's so unbelievable. But how is everything a secret in our families, even natural changes of life? One of the things that people experience when they're going through, and we're going to say the change of life, is some emotional ups and downs and mood swings, which, like you said, could be attributed to the lack of sleep, which makes you irritable and agitated. But is there other causes, the hormonal reduction or any of that kind of thing that would add to the emotional and mental ups and downs people might experience?
It's a whole constellation of different things that can cause
Mhm.
the problem.
Mhm.
Estrogen waning in itself doesn't really cause depression, but
Okay.
hormone level swinging can. But when we look at the age of women who tend to go through menopause, average age 51, we have a lot of things on our shoulders at that particular point in our time. We're looking at the fact that we're no longer fertile. That really affects a lot of women when they feel like that was their main role in life, that they're no longer, that door has been closed. So some women go through a loss and a grieving period just from that. They may not realize it, but they
Mm,
do suffer from that. They're also at a point where you're middle life. Um,
yeah.
it's hard sometimes to say, hey, wait a minute, but I'm probably not going to live until I'm 100 years old. It would be great if I did. But once you get to be to your mid 40s, then we're in our midlife. And
Mhm.
there are a lot of things on us. People start looking at their careers, where they are in their life, relationship, the kids, and that in itself can trigger depression while you're going through your menopause. Other stresses in your relationship and your job. Your parents are older, so you're dealing with elderly issues and caregiver issues. So there's so many other things that impact it, and it happens during menopause that people attribute it to menopause. And
Mhm.
unfortunately, even if we give them hormone therapy, that's not going to fix those types of
Yeah.
symptoms.
Yeah.
So still need to see a therapist for talk counseling, possibly a psychiatrist for medical therapy to work through some of those issues and to help them be able to rebalance because those things tend to happen at that age. And we contributed most things that happen to us when we get to be a certain age. We say, oh, it's menopause. Oh,
Yeah, it just we lump it all into the change. Our favorite term is the change. I'm going through the change. And we do have a question from the audience. This person said, I started menopause at 37. Do you think that's too early?
well, that is considered to be premature ovarian failure. Less than 1% of women go through menopause that early. So
Mhm.
it's not really considered menopause per se. If you go before you're 40, we consider that to be premature ovarian failure. So I'm sure the doctor would look at other causes because sometimes autoimmune diseases and things of that nature can
Mhm.
cause people to go through premature ovarian failure. And those women that go early it's very important that they replace their calcium, replace their vitamin D, because so many years of not having any estrogen, which helps to strengthen our bones, they are at a higher risk of breaking something very, very early. So when we get older, you hear people unsteady on their feet, they might break something. And if you break your hip, that is life changing for women. But when you start this at such a younger age, those women are at such higher risk of breaking something. And we also put those women on hormone therapy because they're supposed to still have good amounts of estrogen for another 10, 15 years or so. And so it's doing other things to help the bodies, the heart, their
Mhm.
and the vaginal tissues. So it's not always just the symptoms of the hot flashes that we feel that it's affecting, but that younger group, whether we put them through menopause on our own, sometimes we have to do surgeries, sometimes people get chemotherapy or radiation. All of those
Mhm.
women, we have to look at the side effects of going through early menopause and how we can mitigate some of those things. So definitely get with your provider and speak with them about those risk factors and
Mhm.
make sure that they get you on some hormone therapy.
Right. Are there certain STDs that would cause infertility or early menopause?
There are sexually transmitted infections that can cause infertility or increase your risk, especially if you end up getting pelvic inflammatory disease, PID,
Okay.
chlamydia. Those are the main culprits because they scar up your tubes. So they're blocking your tubes, but they don't affect the ovaries. So
Okay.
women who have tubal damage can
Mhm.
still some fertility treatments where they get their eggs harvested because their ovaries work. It's just that they don't have a pathway to get through the tubes to get to the uterus.
Okay.
Women either end up with tubal pregnancies or end up not being able to get pregnant because the egg can't get through the scar tissue. Thankfully, it's not that common for people to get PID, and
Okay.
you screen high risk people 25 and under quite often when they show up to be sure because it is silent in most cases. People
Mhm.
may not know that they've even been exposed.
Yeah, and that's why I brought that up because a lot of times, some things don't have symptoms or we just aren't aware that things are happening to our bodies that could have, long-term impact. And I know some people are put on birth control earlier if they have severe cramping and things of that nature. Would that impact a person, being diagnosed with early menopause if they were on these? I know some people that were on them where they just never have a cycle.
No, it doesn't impact early.
Okay.
Once you come off them, your ovaries kick back in. And
Okay.
definitely for the younger ladies that have anemia, they're bleeding really heavy, they have back cramps. I put a lot of adolescents, the pediatricians turn them over to us to manage their cramps because the quality of life is poor. They can't participate in school activities, they're missing classes, and that definitely is a problem for them. But I do stress to the moms, because usually the moms are there, that it's not going to increase their risk of infertility. It's actually going to improve their quality of life. They won't be anemic, they'll have energy. And when we have women on birth control pill, regardless of the age, it actually decreases your risk of ovarian cancer because your ovaries are resting. They're not working every single day, so they get a break.
Mhm.
So they have good. Well,
Yeah, these are things, look, I've been thinking about, so I'm just throwing them out there. It's like, okay, good, it's not on our list, but these are things, if I'm thinking about them, other people, uh, may not be aware of that. And when mothers or parents are approached by doctors to put their daughters on these treatments, they might be leery of them. But as you're saying, it's about the quality of life and them being able to engage in normal activities, as a teenager. So that gives me my other question. You already said, hey, the ups and downs are caused by other life issues. So we might feel stress when we're in the menopausal age or perimenopausal age because we're caregivers, parents, still working, maybe retirement, or have health concerns. All of that on top of going through physical changes can lead us to feeling, the emotional ups and downs. But it's definitely something, if you're listening to me, to bring up with your primary care, your gynecologist, so that you can get further treatment. Again, our aim is we don't want people to suffer in silence. There's no need to suffer when we have so many ways to be better and feel better. We just have to get past the shame sometimes of bringing up these topics to the people that can help us. And so that's what this is all about. So hopefully, as you get informed, you get to break down those barriers so you can have these important conversations with your health professionals or your loved ones.
and I promise
So,
there's absolutely nothing that you can say to your doctor, your GYN in particular, that they haven't heard before. So the issues that women are having, we may not sit down and discuss them one on one or with our family members. Especially in certain cultures, we're really, really quiet about our personal life. That's personal business. Don't put your business out, type of thing. So people don't always realize so many people are going through the exact same thing. And so a lot of people don't bring it up to their doctors and they feel embarrassed. And when people start asking me questions about menopause, particularly if it has to do with sexual dysfunction, they always start off with, I'm so embarrassed to have to ask you this. And I'm like, but it's my job. If you're not going to talk to me about it, then who are you going to talk to about it? So it's
true.
important that
Yes.
you and that we are there to answer your questions.
Yeah, that's great. It's like when people are in a session and they start crying. Oh, I'm so sorry, I'm crying. I said, this is the place to cry. This is, it's okay to cry. This is the no judgment zone. So it's good, for us to have this conversation. Switching gears, we know it's Breast Cancer Awareness Month, and as younger women, I know a few younger women that have been diagnosed with it, and it's not, I'm not going to say it's on the rise. It's just that people are sharing their stories more. But we do know that there's a higher percentage, from research that uh, Black women sometimes get diagnosed with breast cancer at younger ages, and it's the more severe, or by the time we find out, it's staged out uh, further. So what are your how can we approach that so we can be more, hopefully, on top of that, since it's affecting us at younger ages?
So, in general, the lifetime risk for developing breast cancer is about 1 in 8, and we're much more likely to develop it when we're over 50, over 55. So, it is a concern for younger people, but I don't want people to be obsessed with thinking that they're going to get, even though we all know people who are in their 30s and unfortunately have dealt with breast cancer because it affects so many women over the course of their lifetime. So, women that are young are studying
Mhm.
mammograms, is what we have. That's the main study that we have, along with clinical breast exams and self breast exams. The majority of women do find their own lumps when they're
Mm.
doing their own exams, or it gets found at a clinical um, setting for those women who may not be in the range of being able to get mammograms at that at because they're not in the right age group. there's always a debate as to when we should do mammograms. The
Mhm.
OBGYN Society, we recommend age 40 and that you get it at least every year. There's some people who say 50, but I just think that's way too late, particularly for women of color.
Mhm.
Mammograms is looking at the density of breasts. Some years ago, Congress decided that we need to know whether or not we have dense breasts. And then everybody was like, oh my God, my breasts are dense. But our breasts have always been that way, dense.
Mhm.
So they just started reporting it to the patients. And what
Right.
is when they're looking at the mammogram, they may not be able to, they're looking at shades of gray and they're looking for calcifications, which usually look white. And if your breasts are really, really dense, they can't really see those calcifications. So that's one of the reasons why mammograms is not so effective in the younger population, because
Mhm.
they're going to be able to really see the masses that they're looking for, the changes that they're looking for, which is why we tend to have those later diagnosis after something is
Mhm.
because they're not a part of the screening group because their mammograms are not going to be very sensitive. And you end up picking up a lot of false positive and putting people through possibly unnecessary procedures that they may not need. That being said, I think it's important for us all, like we were talking about, not making everything a secret and being so
Mhm.
taboo, that we know our family history. If it
Yeah.
means we have to
Yeah.
harass our aunts, our moms, our grandparents,
Mhm.
about their medical history, because their medical history will definitely impact us as well. And that way, if we do find that we have certain pockets of cancer in our families or certain types of cancer in our family, then we can talk with our doctors about whether or not we should see a genetic counselor and have genetic testing done, because that is available. And that way, women
Mhm.
have a better idea if they are at a higher risk of having a young, being younger and developing breast cancer, particularly if they have family members that were young, if they were under 50 and they developed breast cancer,
Yeah.
it could be some type of genetic issue going on.
Yeah, that's good to know. Back to the menopause, we have a question from the audience. How safe is HRT? And I think that's hormone replacement therapy. And
Yes.
and on average, how long can menopause last?
Okay, I'm gonna take the second question first because that's the easy.
Mhm. Yes.
For the most part, okay, remember we said menopause means you stop your period and you're
Yes.
postmenopausal for life. So you meaning the symptoms of menopause.
That's
Menopause
probably it.
symptoms can last from 6 months to 2 years on average, but it could be 10 years.
Mhm.
There are some patients that they never go away, and there are some patients that they go away and they just start again. So if they start again and you're 70 something years old, uh, the chances of anybody putting you on hormone replacement therapy is going to be slim to none.
Mhm.
Uh, if you're a younger person, it's a different story. Back in before 2002, pretty much every woman got HRT.
Mhm.
It was part of your menopause. Oh, your periods are gone. Here you go. You take this pill every day and you'll be fine. Because we thought that we know that estrogen protects the heart. And we thought that not only would it treat your hot flashes, but it would also decrease your risk of heart disease. And in 2002, a couple studies came out that showed not only did it not decrease your risk of heart disease, it increased your risk of heart disease, along with people who were on combination therapy of estrogen and progesterone. If they
Mhm.
still had their uterus, if they had not had a hysterectomy, those women had a higher chance of breast cancer. So they took everybody off of their hormone therapy.
Everybody, yep.
And doctors stopped prescribing it, patients stopped taking it. The patients who had horrible flashes came back in and had to go back on it. And then they did good quality research. What they learned was from that study that they were studying women that were 70 years old. And that's completely different patient population than what we were dealing with when you first start menopause. And
Mhm.
so we look back and we decide how old you are. So if you are just starting menopause, and particularly if you're around your 50s, if it's within the first 10 years of menopause and you're under 65, then hormone therapy definitely can be an option for you and a safe option. We
Mhm.
is on the lowest dose possible for the shortest period of time. And so now, back in 2002, they pretty much had like one dose. Now there's multiple doses. There's also multiple ways of delivering it. Not only oral pills, you can do rings that you place in your vagina, you can do patches, there's lotions. So there's a lot of different delivery systems. So
Okay.
there's that got rid of the blood clot risk that we were noticing when people were on hormone replacement therapy. So it's definitely a safe option, and we also only use it now for those vasomotor symptoms, the flushing, the hot flashes,
Hmm.
that we can focus on the symptom. So if you're having genital issues, we focus on genital medications. If you're having cognitive issues, we focus on, the antidepressant type medications. And
Hmm.
really, if you're having painful intercourse, they have specific medications for that now. And we really only save the estrogen therapy for the moderate to severe hot flashes.
Oh, that's great to know. Someone else came in. This the hot topic of when should you, as the person's approaching 40, how often should they visit their GYN?
You still should see your GYN every single year. I know that we don't run PAP tests every year anymore, depending upon your age group and what your
Mhm.
past result was, but you see them once a year. And that way we can check in with you, see how you're doing. There are a lot of little subtle things that patients may not realize that we notice that you may not be aware of, or things that
Mhm.
we can point out to you in terms of your health care. And there's some people who only have a GYN. They think that I'm their primary care doctor. And I'm like, no,
Okay.
you need to see a primary care doctor.
Yes.
They're
Yeah.
looking at and I'm looking at. But definitely you need to see both your primary care doctor and your GYN yearly. If you have medical problems, you probably be seeing your primary care doctor more often.
Now, what kind of quality of personal health care would you suggest for someone on when they're between visits? Is there something we should be doing between visits?
Oh, definitely. Lifestyle, lifestyle, lifestyle.
Okay.
For lifestyle. Proper nutrition. It's proper rest. We've got to get out and exercise. We've got to get our body mass index, our BMI down. I know people say, oh, the BMI is not a real thing. Oh, no. It really is a real thing. And it's
Mhm.
associated with higher rates of diabetes and cardiovascular disease. And we all should know, even though it's not Heart Month, that the number one killer in women, particularly Black women, is heart disease.
Mhm.
Not breast cancer, but it's heart disease, and we get that from our poor lifestyles. The stress that we're under is
Yeah,
a big.
that's a
So
big one.
you've got to take time for yourself, because that is definitely going to affect um, the rest of your quality of life. And proper exercise, if you can get out and just walk 15 minutes to half an hour a day, you can do 15 minutes at lunch, 15 minutes at dinner, walk on a treadmill. So many people have equipment right at home, and we won't use it. Even if
Mhm.
you just get up there for 15 minutes every day, you just start doing something.
Yeah.
And that's the best thing that you can do in between your visits, because we'll see the changes. We'll see the changes in your blood pressure improvement. We'll see the changes in your weight improving. We'll see the changes in your cholesterol improving. And this is just with you making a few tweaks in your lifestyle.
That's great, and I think a lot of times we think it's some mystery, behind, healthy living, but it is mostly about lifestyle. It's some things are genetic, but even with that, our lifestyle changes can help minimize our genetic predisposition to certain issues. Someone mentioned, how does ovarian cancer relate to menopause?
Ovarian cancer and menopause. The earlier you go through menopause, the less likely you are to end up getting ovarian cancer, because your ovaries not being so active is a big deal. So
Mhm.
women who've never had a child and never been on any hormonal type of contraception, and
Mhm.
never and go through menopause late, or start their periods early have a higher risk of ovarian cancer. Um,
Okay.
women. There are also a few genetic cancers like the BRCA gene and a couple other um,
Yeah.
gene mutations that have ovarian cancer as a part of the group cluster group, maybe colon, breast, prostate, ovarian cancer. Those are triggers if you have a lot of people with those types of cancers in your family that
Mhm.
um, you would want to maybe talk with a genetic counselor and explore getting some testing done.
That's great information because I think sometimes we focus on just one type of cancer that could be in our families, but we need to know as much about our family medical and mental health issues as possible. Because a lot of times when things happen, we're all taken by surprise. It's a shock, and then we talk to people. Oh yeah, so and so had this, or I had 5 miscarriages. Oh, well, I didn't know that. Yeah, so this is common. So did your aunt, your sister, and these are the things that we don't talk about. And then when it happens to someone else, they think they're the odd person in the family or in their friend group when these things have happened. Someone wants to know about certain foods and hot flashes.
Well, I'm a spicy girl myself. I'll just have to take one for the team. But
Mhm,
spicy foods, caffeine, those are things that definitely can trigger hot flashes.
mhm.
Exercise can help improve hot flashes, even though it seems counterintuitive. You're making yourself sweat, you would think that would trigger hot flashes, but does improve them over time. But those are the main things that may trigger flashes because they're going to make um, your skin vasodilate, which makes you sweat, trying to cool yourself back off because your body feels hot, and that could send you into a
Yeah.
flash.
Yes, and I know sometimes it's sugar, but I know spicy food. Uh, Me personally, I love hot tea, but hot tea will do it. Like you said, the caffeine. And so some things we kind of bring it on ourselves. So,
Own
um,
trick.
but but it's worth it if that's your treat. It can be worth it. Yeah. So, what questions should people ask when they go to their GYN appointment, especially as it relates? We know we had a few answers as it related to menopause, but what about breast cancer? Are there things people should be asking, you know, in that area?
In terms of, in general, you want to know your results of your test. So a lot of the times it is, nowadays we're pretty in touch computer wise. Everybody has a portal. You should be able to
Mhm.
access your chart. You should be able to see what the doctor is saying about you that happened in the appointment, and you should know your test results. It's not uncommon that people don't know their results. They had a study done, and we may not always reach out to you to say your test is normal, but you should have some way of being able to access your result so that
Mhm.
you be able to share that with someone else. I think that's one of the most important things on the provider side of things is patients knowing their history and
Mhm.
being assured of their own history and knowing what's happened to them over their as they've been navigating the changes of life over time. In terms of specific questions, I can't really think of any.
Okay.
The other side, so you definitely want to be sure that you are staying on schedule with your test. Now, I'm assuming because we have certain guidelines according to your age group that the docs are doing the test on time. Like your cholesterol, you should be getting that done at least every 5 years in your 20s, and then start to get abnormal. They're probably going to start doing it every year. Your blood pressure gets checked regularly, at least once a year, and we do all these stratifications according to your age group. But there is one thing you should ask is what are you testing me for? That's a good
Mhm.
question because a lot of
Definitely.
want to test for something and they get blood work drawn. And I'm a obstetrician gynecologist. So if they ask me for blood work, I'm gonna draw things that have to do with GYN stuff, abnormal bleeding, There's certain tests that I do for abnormal bleeding. If they want to be evaluated for STIs, there are going to be certain tests that I do. But I'm
Mhm.
not going to be checking your cholesterol. I'm not going to be checking
Mhm.
certain things. And so people say to me all the time when I'm trying to do an evaluation on them, they're like, I just had blood work done. But they don't know what blood work they had done. They can't tell me the results. They
Okay.
don't know if we're overlapping. And they're probably not checking your ovaries and checking for things that I'm checking for. So it's important to ask your doctor, well, what am I being tested for? And it's probably your cholesterol, your thyroid, and screening for diabetes. And a lot of the primary care doctors may test for HIV, but be specific, because also people say, oh, I just had an STI screening done and they didn't get a lot of tests done. And they don't realize that there are a lot of tests out there and you may only have one. And then when we test you, God forbid, and you test positive for something like herpes, and they say, well, I just had testing done, but that's not what you got tested for. So know what's happening to you. What are we doing today? Am I getting my pap test today? Because we don't run that every year anymore. And people don't always realize that you're not due for it. So no, we're not going to do that today. Just know
Mhm.
what your tests are.
Yeah, that's a good point, because a lot of times we just go stick our arms out and don't follow up, but it's good to be, proactive in your healthcare and know, what's coming up, and also looking at the patient portal, to see what the results are, because again, the doctors aren't gonna always call you back, but you still might wanna keep up with your numbers if you're into the numbers and checking and making sure. Back to menopause, our hot topic of the day apparently is weight gain. Is what can you do about that in menopause?
Weight gain tends to happen as we get older anyway. It's not
Mhm.
necessarily the menopause that's causing it. Just stress in itself releases a hormone called cortisol, which makes us deposit abdominal fat, because that's where most women are concerned as we age. Our stomach,
Mhm.
and we're like, what is going on with this flab here?
Yeah.
What's why can't I get rid of this? But we're again at that age where our bodies are slowing down a bit, our
Mhm.
metabolism is slowing down a bit. And so we really do need to be more active and with the lifestyle. And
Mhm.
it means that we can't eat what we ate when we were in our 30s. And we might be able to get away with not exercising when we were in our 20s, but in your 50s, you're probably going to have to do something differently. And I often tell my patients, because a lot of them exercise. Um, I won't say their version of exercise, but I would say they do their version of exercise.
Yeah.
When you
That's
talk,
me.
it's not really intense, not getting your heart rate up.
Right.
And
Yeah.
there's certain goals that you have. If you want to burn abdominal fat, you have to get your heart rate racing. It's not, you can do all the crunches in the world, but if you have, 10, 15 pounds of abdominal fat sitting on top of the muscles, you're not going to see the effect of the crunches, even though your abdominal muscles are becoming stronger. So we definitely have to be more, I can't stress enough about diet and exercise.
Mhm.
At the gym, they always tell us that, you know, 2/3 of it really is what we're eating
Mhm.
and exercise. So just making changes of cutting sugar. Sugar is a big, big, big thing. And alcohol has sugar.
Yes, it does. Go yep. All
Like,
our wind down Wednesdays and
so
other things, girls' night out.
yeah, so you have to start choosing. So maybe you can have the glass of wine, but you can't have the dessert and the glass of wine and the pasta. So you have to start thinking about things like that
Yeah.
and just making some cognitive decisions. We don't want, I mean, we want you to have a good life and a happy life and enjoy life, but we just can't overindulge in things
Right.
if we see certain goals in terms of weight loss or maintaining our weight.
Yeah, that's a good point because, sugar is in a lot of things that we don't think of it as being in. So it's just being able to make those choices. You can't have everything all the time at every meal. And some people are used to again, their metabolism was different when they were younger and they were able to do those things, but as we age and slow down. And I really wanted to laugh. You said, "What's the point of doing crunches over 15 pounds of belly fat?" So it's so funny. It's like, yes, why are we doing that? Because the fat isn't going anywhere. All we doing, we are improving our muscles, but the fat is covering up the muscles. So it's kind of it's good. And we feel good about ourselves, but it really is difficult to do those lifestyle changes, but it's so important because, again, all of this lifestyle choices you make, improve your stress, do self care, work out, eat properly. All of that helps with everything. It's not just, it helps with your mental health, your emotional health, your physical health, your whatever you have going on. It helps you to do better in those different areas. I'm going to segue into our other topics. So we hit on menopause and those changes and transitions. We talked about breast cancer and just GYN issues in general. But now, one of the other top concerns that is a part of our community is domestic and intimate partner violence, which happens to be one of the number one causes of death for Black women is intimate partner violence. So it's something that's really, again, it's hard to get people out of these situations, but if if we're supportive of them as much as possible and give them the information, prayerfully, they'll be able to get out and get out safely. But how do you screen for that in your practice?
It's definitely a difficult task, and a lot of people are in those type of situations during their pregnancies. And so we definitely see a lot of violence or attacks on women while they're pregnant that could not only be harmful to them, but also harmful to their unborn baby. So we, in general, in my office, we have a questionnaire that the patients fill out when they come into the office. And we're
Mhm.
just asking simple questions about the safety that you feel when you're at home. Are you having any problems? Are you being emotionally or physically abused? And every now and again, someone will tell us about it, or they'll tell me that they've been in a situation. And we also leave materials in the bathrooms because our bathrooms are just for our patients. And so they have private information there where they'll be able to view alone out of the prying eyes of their partner. So they don't have to worry that the partner would see the information that we are allowing them to have access to. So those are the main things. But in general, for people who are dealing with their family members, just knowing that they are, just keep your eyes open. If you find someone that seems like they had a lot of joy and you can literally see the light go out of their eyes, if you find people who are isolating themselves, and we've
Mhm.
all been around people who seem to have controlling partners, they tend to isolate them from their families, their friends, so that they don't have that resource that they used to have, so that they don't feel comfortable going to other people because they're all alone now. And a lot of the family members and friends get frustrated because they're absent all the time. And that is the goal a lot of the times of domestic violence and abuse
Mhm.
is social isolation. And so that those women really, really feel alone.
Yeah, that's a good point, that social isolation. And also, wanting making demands of the person to change, change your hair, change you used to wear makeup, you can't wear that anymore, or the clothing you used to wear, now you need to change that. So some of those subtle things, if you notice those things, also if persons start needing to borrow money from you because one type of intimate partner violence is keeping, the finances separate and keeping them away from the other partner. So financial abuse is it, medical abuse, keeping people from the care they need, saying, "Oh, you don't need to go to your doctor appointment. Weren't you just at the dentist?" And or just different things that are small, but it may seem like when this happens to you or a friend, it may seem something that they can brush off, but it's not. It's really building up to a control. And remember, with this type of situation, it's power and control. It's never love. It's never love. And so that's if you, are in this situation yourself or other persons, it's never about love ever. It's always about power and control. And unfortunately, like Dr. Carmen said, a lot of pregnant women find themselves in harm's way. And we hear this a lot. That is the highest, the mortality rate in pregnant women, the highest amounts in Maryland in particular, is from domestic violence. It's not because they died during pregnancy or had some kind of medical emergency. It is the violence, inflicted upon them by their partners. So this is something that is happening to people we know or people we hear about, and we're like in shock, of course. But it's also something that is used even in church, some church communities or religious communities where they use scriptures and Bible verses to again power and control. It's not about love or honoring God as sometimes people uh, you know, dispel that information in that way. So these are things that really impact us and ultimately our children because they're living in these homes where this power and control, you know, goes down to them where they're not able to go to school because maybe they're abused or they've seen their mother abused and they're trying to comfort her. So these are things that are a challenge all the way across the board. So, again, if you have any questions about it, I know menopause was the hot topic tonight. So, good thing we put that in there. That seems to always be a hot topic since many of us are in their age range or are postmenopausal. Now we know the correct term for it. And but those things, this happens to women at any age. So I will say that it's not just younger women. It happens to women in their 60s, 70s, 80s as well. That can be uh, in abusive situations, and it could be family violence where their sons, daughters, and grandchildren could be inflicting, abuse, stealing from them, just different things that are abusive. So if you see something, say something, to your neighbor, or ask the question, is everything okay? I noticed too now in most primary care physicians' office, they ask you things. Is everything okay at home? I noticed you the last few times you came in here for a fall. What's going on? They may ask you little questions trying to tease out if something is going on. And sometimes we get offended, but they're doing their job if they're asking us why did we fall 5 times in the last 6 weeks. That is unusual. So, but I know someone, they said, well, I was offended that they asked me that. Well, they're doing their job. So, if your doctors are asking you these kind of questions, they are doing their job. So, anybody have any questions on that, or Dr. Carmen, you have anything else to add on the intimate partner, domestic violence?
Yes, you touched on it with elder abuse, and
Mhm.
I see a lot of patients that are elderly and may be a part of group home programs
Oh.
or maybe have some mental challenges. That's a
Mhm.
population to make sure you keeping a good lookout of,
Yeah.
that they're used, because not all of them can communicate effectively. Or if someone has a mental health issue, it doesn't mean that they may not be telling the truth when they're saying that they're being harmed. So that's a little bit more complicated to sort through, but it's definitely something to keep an eye out when you have patients that are coming across um, providers that give them direct care and they themselves have limited physical capacity or mental capacity, whether it be from some mental um, problem like schizophrenia or something of that nature, or some issue like Alzheimer's. Those are things that you definitely have to keep a look out for.
Yeah, I'm glad you mentioned the elder abuse and including, other vulnerable adults and even children, because what happens is they aren't able to articulate, the issues that might be happening to them, or we may not believe them. If we see a broken arm at the nursing facility when we visit our loved one, we'll assume that it was a part of just a normal something happened, they fell, not realizing they could be abused at the nursing facility or at the day programs that, our family members are attending. And so it's really good, in these cases where they're vulnerable adults, that we do pop-in visits like we would do at schools, where we just show up and let people know that we're checking in on the facility as well as our loved one. I was talking to someone recently and I said, "Oh, were you able to visit them? Were they getting their things, at the facility?" They said, "Well, the facility uh, can't secure people's items, so the abuse too is theft. So some of them have things that are in these facilities, but they don't go back home with them. There's things that have been taken from the vulnerable adults, and so." It's like things you don't think about because like who's stealing from those people, but they are, or who's hurting them and uh, beating them. But also something that we don't talk about, being sexually assaulted at these places as well, which is also, there is a part of domestic violence that includes, rape. So where people are raped as the crime against them. It's not about love. Remember, none of this is about love. So it's about power and control. And rape is about power and control. It's never about love. So these are things that are happening in our community. And one thing that I heard at a conference, and then the pastor said even on Sunday, we need to just show up at some places. We need a presence. We need to show up at the school board, at the nursing homes, at the wherever we can, the schools. If they have volunteer applications, yes, they can be a hassle to fill out, but we might need to fill them out so that we can just show up and be a presence to mitigate some of the um, hurts that our community is suffering because they feel like no one cares, but of course we do care. That's why we're here tonight. So I don't know. I feel like we've covered a lot of ground. Um, Hopefully this gives you something to think about, whether it's menopause, your overall health, including breast health. We know we all need to make some lifestyle changes, decrease the sugar, increase the exercise, uh, and you can look up what's in sugar. So, what has sugar and sodium? So, you can't say, well, I didn't know it was sugar. You can say, what is the name of sugar in this kind of food? And it'll, Google and all these search engines are our friends in that regard. Um, Here's a final, almost final GYN question. Oh, it's a couple of them now. How often should you see a GYN if you are not sexually active and over 75?
Medicare is only going to let you come every 2 years. I feel strongly that you should come almost every 2 years, whether or not you're sexually active, because you've had so many years without estrogen. Your vaginal may start to have issues of what we call
Mhm.
vaginal atrophy. Women may start to suffer from incontinence. They may have relaxation where their bladder drops or their uterus drops down low. And those are things that we can offer treatments for so that they can feel better with their quality of life.
Okay, that's great to know because sometimes people say, "Well, I've aged out of going to the GYN," which as long as we're here, sounds like we need to go. So it's because as we age, a different set of issues. Um, Another comment is having a radical hysterectomy. My doctor says GYN is not necessary. Is that correct?
Well, you don't need a pap test anymore. The radical hysterectomy, I was assume, was because of cervical cancer, but you probably are suffering for some um, what we call genital urinary syndrome, where you probably have some vaginal dryness and some atrophy, some thinned out vaginal areas. And so I definitely think maybe you don't need to see the oncologist anymore. They really don't want to see you. They want you to see your general GYN. But I still say you should see your regular GYN. People with a radical hysterectomy, it means they've also had part of their vaginas removed. And so, even seeing the GYN for pelvic therapy,
Mhm.
there people don't realize, but they're PT for pelvics, for the pelvic
Yep.
therapy, which
Mhm.
can help with your bladder issue, your bladder control for people who don't want surgery. They can use vaginal dilators to have help with scarring, which happens to a lot of people that have radical hysterectomies or radiation to their pelvis. So I definitely think you still need to see the gynecologist. You just don't necessarily need to get a pap test.
Okay, that's great to know. Again, it's never no question. It's not a good question. And also, we still need to get medical care until we're not here. Let's go there. Because by stopping it, sometimes we live a lower quality of life for things that could have been treated, but we didn't know they could have been treated or we could have been helped, but we thought we aged out of visiting certain doctors or getting certain care, or it's not worth it because of our age or whether we're sexually active or not. So some things are important no matter what age you are. Final question. Should one be concerned if there's discomfort in the breast area?
Yes. It's better to be safe than sorry. So if it's not something that's going away, then you definitely should see your provider. If you've been drinking caffeine like all night for days and days, that can definitely make your breast tender. If you have a reason for it being tender, like some trauma to your breast, of course it's going to be tender or bruised right after you had that issue happen.
Mhm.
But in general, we're here for you. So you just make an appointment, you go in and you tell them you have a problem with your breast. The GYNs were kind of like the primary care doctors for the breast, and we'll get you situated, decide what needs to get done, and if you need to see a breast specialist, get you into the hands of the right person. But it's better to come in and find out that everything is okay than just ignore it and sit back wondering.
Yeah, because the wandering adds to stress, the stress adds to us stress eating, the stress eating adds to our lifestyle issues and choices, and it's just a cycle. And then we get depressed from the worry. So some of these things are seem not related, but end up being related because it lends itself back to worry and concern when we can go and they could say, "Oh, you're always showing up." Oh, well, I'm here. I'm being proactive in my health care. You're a part of that. And it's okay if you have questions. And that's why the healthcare providers are here. I'd like to thank Dr. Carmen for joining us this evening And remember, if you have any mental health needs or questions, you can call the Renaissance Center at 410-409-0025. We thank you, Dr. Carmen, once again for joining us. It's been such a great conversation, and I think people got help and obviously can help others in their family and friend circle to be more informed and take charge of every area of their health, mind, body, and soul. Thank you.
Thank you for having me.